Thank you very much, everyone, for joining us. I'm Mina Fazel. I'm a Professor of Adolescent Psychiatry at the University of Oxford, and I'm part of an amazing team of people who've been working on the OxWell student survey, and we're going to be sharing some of the early findings from the latest survey that was recently conducted. So you will be meeting everyone, a few of us, over the course of the next 45 minutes to an hour. So these are early findings. They are of young people who completed the survey. They were, I suppose we want just to be aware of what it's not. So these are students who attended school on the day the survey was run, at a school that the survey was conducted. They had consented to participate. Their parents didn't opt them out. And it was for those for whom the survey was accessible. So there are limitations, and that it's important to understand that there are groups that we're very interested in knowing about that haven't responded to the survey, but we've had incredible numbers of those that have. We've already sent reports to all the schools that participated, and it's an incredible opportunity for us to learn about the young people who've completed the survey. What I want to really also underline is that today, the people presenting represent what OxWell has been able to do, which is draw a lot of other researchers to devote their time to understand these findings. And all those presenting here today are here because of their passion, rather than because they're part of and employed by the OxWell team as such. So I'm very grateful for the time they've put into this, and also we welcome more people to come and work with us on this. We have a Q&A. Please put any questions in there. Members of the team will answer that, because we won't have a formal question answer at the end, but we'll try and complete and answer as much as possible. And also please email us at any time with questions and also with ideas. We welcome them openly and keep in touch. So this is what we're going to now cover. A range of some of the findings and talk a little bit about some of the future plans as well. So the OxWell survey is a big survey. Over 200 questions are asked, covering a whole range of factors that might be influencing mental health and well-being. So we're incredibly grateful to the students who completed it and spent so long answering it, some up to an hour in their lessons doing this. And we have an opportunity to learn about a whole number of things. And so today, excuse us for only giving you the tiniest snapshot of what we've found. But this is what we collected this year between February and March. Over 43,000 students logged in. And because it was quite a long survey, not all got to the end, but over 25,000 did complete the final page. So it's unbelievably useful information they've provided us with, and it's from years 5 to 13, and those are the different numbers of students that are represented in the year groups, and 185 schools and further education colleges participated. As I said, each of those have had a tailored individual report, and that was the first thing we did. And then all of the commissioners in the areas in which these schools sat got a combined report of all the young people in their area as well. So this just gives you a breakdown of the areas that are covered: Liverpool, Oxfordshire, Berkshire, the main areas that are covered. And we're really trying to encourage this data-driven approach. We've got a data platform, so all our schools, all our stakeholders are able to access data that's not identifiable. You can't ever work out which student has answered what question, but the schools could go in and look at their bullying data or their exclusion data or their racism perception data or whatever it is that they would like to know. But we're also, wanting other people to look at it. So our commissioners also have access to this platform and are using it for a whole range of transformation and other planning, as well as citywide approaches that Chris is going to talk to us about. And so I'm a psychiatrist, so anxiety and depression are major concerns in this population. So these first two slides just show you according to the males and females, and those that are scoring high, which is in dark blue, and symptoms of anxiety. We do ask about male, female, and others. So I'm only presenting the male and female here. About 4% identifying as other, and another 4% are saying they'd prefer not to say. So we have to be very mindful of the groups that we're representing here. And also of depression. So again, substantial proportions of young people experiencing high symptoms of depression, up to 1 in 5 males by year 13, and 1 in 3 females by year 13. So I'm now going to hand over to Emma Soneson. She is a postdoctoral researcher working in the team here in Oxford, and she's going to share some of the findings around vulnerable populations.
Thank you, Mina. So one thing that we're really interested in as a team is how we can best support what's called here as vulnerable populations, but also could be thought of as young people who are sometimes minoritized or marginalized within schools or societies. And we ask a range of questions within the OxWell survey to help us get at some of these characteristics. Next slide, Mina, thanks. So if we look at the overall trends, we are taking loneliness as an example here instead of depression and anxiety like Mina just showed. And if we look at overall trends of loneliness across the year groups, we can see that we have quite high loneliness, which is represented by the dark blue and the teal down below. Among primary school, it dips a little bit in years 7 through 8 as we transition into secondary. And then by the time that we're at year 13, we are getting, again, about 65% of young people reporting that they feel lonely either some of the time or often. And like I said, we're very interested in learning about those young people who are more likely to be marginalized or minoritized. And so what we did was we looked at rates of loneliness according to several characteristics. So the first that we looked at was young people who endorsed the other gender option, which were gender non-binary children. We also looked at minority ethnic children, children who report having chronic illness, who report ever being excluded from school, and who say that they have frequent concerns about having enough money to afford things in their daily lives. And what we can see here is that the groups in teal represent the pupils endorsing these options. So they are non-binary, they are part of a minority ethnic group, they do have chronic illness, they have ever been excluded from school, and they do have frequent money concerns. And we can see that across each of those categories, except for being a member of a minority ethnic group, we have on average a higher proportion of pupils reporting that they feel lonely often. And so we're particularly interested in the groups right here, the non-binary groups, and those who are more likely to report worrying about money. So these are the findings from the primary schools. You can see on top of each of the bars, it gives a number of the pupils that report each of these characteristics. So while they might be a minority of the overall groups, they are really important in understanding how we can best support them and how we can build up their social connections so they don't feel that loneliness. Moving on to secondary school, again, we have a lot of the same characteristics, but in secondary schools, we also ask whether young people perceive themselves to be neurodivergent, as well as whether they are care experienced. And so that can be whether they are currently a child in care or a child looked after, or if they ever have been. And again, like on the previous graph, the teal bars are representing those young people who are endorsing these characteristics. And just like we had in the primary schools, young people who are saying that they're gender non-binary or who worry frequently about money are more likely to report often being lonely, up to 45% actually, compared to their peers, which are in that dark blue. And for the secondary school students, we also see another trend, particularly for chronic illness and whether they perceive themselves to be neurodivergent, both self-reported, where they are much more likely, again, than their peers who do not have these characteristics to report often feeling lonely. And so what can we do about this? How can we actually take action? So the first thing that we would recommend is identifying the need within your school. So every school is going to be really different. Some schools will have a lot of students falling into one of these categories, and other schools will have other categories as well. And so using the OxWell data to really examine in your school which groups are most likely to feel lonely in order to identify which young people might need more support in building social connections, for example. We're also recommending to take action in terms of incorporating the student voice. So working with students, particularly those that fall into these vulnerable groups, to devise ways for tackling loneliness. And we've seen schools have a lot of success when they work with young people who have these characteristics, because they will have really unique insights into how to ensure these young people are supported both in school and out of school. And then in terms of taking action, we've got 2 points here where we think that there is the highest chance of being able to tackle loneliness. The first being an overarching ethos of respect that values diversity. So this is something that most schools are already doing, and many schools doing incredibly well. And we know that this has a strong evidence base in terms of reducing loneliness. So when you're thinking about your plans and your strategies for promoting this ethos, it's also important to understand student views of it. So how are students perceiving the actions that the school is taking in order to promote this positive and caring environment? The second is we would suggest providing opportunities to build social connections. And I've already said that word a couple of times, but social connections are absolutely crucial for reducing loneliness and may have also positive impacts, knock-on effects on mental health and well-being more generally. And this could be done inside of the school day with extracurriculars and clubs, but also it's important to build connections with the wider community, because there are a wealth of opportunities in that wider community where young people can really build those connections, both with their peers, their age, as well as older peers, younger peers, and adults, which is something that's come through as really important within the wider OxWell survey. So that was our bit on the vulnerable students and loneliness. And now I'd really like to introduce Chris Price, who's the head of education partnerships for Liverpool City Council Education Directorate, who will talk to you a bit about how he has used the OxWell data in his local area.
Thanks, Emma. So we're just going to give a bit of an overview of our journey. We took part in the OxWell survey in 2021 for the first time. And when we did it, we had a great uptake from the schools. We had around 12,000 students participate in the survey. And in one sense, we were overwhelmed with the level of data which we got and what to do with it. So we had a multi-agency partnership group called the Education Improvement Plan, and one of the priorities was around mental health. And we had partners such as the ICB, public health, school representation, school health, and third sector organisations, mental health practitioners on the group to discuss what to do and how to move things forward with this level of understanding. Our initial response to the data was well, we already know this is very obvious what it's telling us, until we started looking into the detail behind it and delve into it in a bit more detail, speaking to the schools, speaking to the partners. And we created a group with our strategic partners to look at the information in a bit more detail and triangulate it. One example of how we worked with the schools on the data was around bullying. We looked at the correlation points between the children's response to having been bullied in school and their response to how they feel schools are dealing with bullying. And we looked at 4 different data points. We looked at those with high bullying levels and the school were dealing with it well, high bullying levels and the schools were perceived not to be dealing with it well, low bullying levels and dealing with it well, and low bullying levels and not dealing with it well. And we had conversations with the schools in these categories. And what we found from that information, speaking to the schools, is where the schools were high bullying but dealing with it well, there's a lot of restorative practice taking place in school, a lot of time going into the pupils after an incident, talking to them, bringing them together and having them to understand each other's perspective and coming to a consensus. Where we found that it was the schools were dealing with it well and there were low bullying rates, what we found out was there was a lot of work around children's rights and respect, and a lot of work around with UNICEF and some of the work they were doing there, and allowing the children to understand each other's values. And that links in with what Emma was talking about around the loneliness and the belonging, and allowing the children to feel that they understand where their part is within the school. When we've looked at this year's data, when we've had those conversations with those schools, we've seen a change in approach with some of the schools, and they were telling us through the years how they're going to do things differently. And we have seen a shift in some of the schools with high bullying, but dealing with it well, when they have taken the UNICEF approach and the children's rights approach and the respect. And we've seen their data, their bullying levels drop significantly over that period of time. So we've got some pockets of success of where we've looked at this data in detail worked with the schools, taken good practice from the schools and shared it with others to see how that can impact what's going on within the children. Following that, we had a grants program. What we wanted to do in Liverpool is we wanted the schools to look at their own data and to go into the data themselves and say, my priority in my school is this, and what resource can I have to try and help me implement it? And we were fortunate enough at the time to have resource from comp funding to be able to enable that to happen within the schools. So we funded 37 projects. They're still in play at the moment, so we're waiting for the outcome of those projects, which will be completed in about October. But it was just a way of bringing the schools with us on the journey to help them understand and read their data and start to interrogate it a little bit more. As well as that, we've used the data to look at how we commission different things, and we've been able to prioritize commissioning, but also support schools when we're prioritizing the information as to who the resource goes to. And one thing that schools do a lot of is they do a lot of everything. What they'll do is they will see an opportunity and want to embrace it, but it's very difficult in a school day to fit everything in. So what we want the schools to do and what we want to do is to prioritize the resources to the schools who need it most. And that allows them to be more efficient with their time and us to be more efficient with our resource as well. So it's working collaboratively around that to try and prioritize. We did learn quite a lot over the course of the last 18 months as to how to manage the data we've received this year. And the timing of the data has been good for us because we received it in, survey was March, we received the data in June, and we've been able to respond to it within year. So this week has been quite a busy week for us. We've had a lot of schools engage in different events. So we've had 4 events this week. We've had a children's event at the primary schools where we've engaged with the primary schools and shared with them the outcomes of the survey. We've then wanted to go into a bit more detail as to what they want us to do to respond to that information. So have they wanted us to listen to their voice and act on it in a certain way? We discussed in detail friendships, belonging, loneliness, bullying, help seeking, and body image. So there was a lot of conversations around those different areas. We did an online event with the primary schools and had around 1,000 children sign up for that event. We then did a secondary school event in the town hall in Liverpool, and in that town hall we were able to discuss with the secondary school children how they want us to respond. Now through that we had a visual artist who captured the minutes and captured the information from the children, and on the screen is what the children told us they wanted us to do and how they wanted us to respond. We've couple of things which came out quite significantly through that is there was a perception from the children in the sense that we get information from them and hear what they're saying, but we don't necessarily respond to it, and they want to see more action taken as to what they're saying. And it's important to take a group of children from different walks of life together and bring them to the priorities and respond to it in the way they want us to. So that's something which we've been able to take back to the schools. We've been able to then do some staff workshops with schools from across the city. We had about 40 sign up over the course of the week and covered 4 different elements. Firstly, feeding back the information to the schools and saying this is what the data has said from a city perspective. And what was really interesting is we had both schools who took part in the survey and those who didn't come to the workshops and feed the data back to them. Then it was about how they could look at their own data and to prioritize things within their own data within their school. One of the things, as I mentioned before, which we learned was that we were potentially overwhelmed in the first instance with the level of data. And then when we look at the schools with the workload they have, it can be very difficult for them to have a look at 200 questions, data set, triangulate the information and decide what to do. So from a school's perspective is we were able to help them to focus on a small number of priorities from the data from their own data source, and if they didn't take part from the city data, to then use the load seeker platform to see how they can delve a bit deeper into the data. And then we created a framework for them to then develop an action plan of what they will do on their school level. And then we'll work through that action plan with them through the workshops we've been doing. And then finally, we highlighted what resource was available for them. So when we work with the schools, one of the complaints we would have a lot is about finding the time and finding the resource to do all the things we're asking them to do. So it's around being efficient with our PSHE curriculum, how we can link the questions and the outcomes of the OxWell survey into PSHE. Where can we get lesson plans and resources to help deliver on some of the areas which they've been highlighting? What was available from a training perspective to make the staff more knowledgeable around what's available, and then looking at how this would play out over the course of the year. So we've done a number of workshops around that this week. We will revisit those in the autumn term of the school to try and support the schools who weren't able to participate to engage into it. And then in 6 months' time, we'll touch base with the schools to see how they're getting on and what they're doing. So that's kind of where we're up to with what we're doing in Liverpool. And I'll pass back to Mina.
Thank you very much, Chris, for coming and showing really how valuable this kind of data can be. So I'm now going to share some of the responses on shape and weight concerns. And this is the first time that we at OxWell have asked these questions. So this is the fourth wave of the OxWell student survey, and it's the first time we've asked about shape and weight concerns, mainly because so many of our kind of services are concerned about this. So we asked, do you regularly skip meals at school because you have a shape and or weight concern? So we're very aware of the cost of living crisis, and we have a separate question about skipping meals because you can't afford to eat, which is incredibly important and we need to be aware of. But this question was specifically asking, do you regularly skip meals at school because you have a shape and or weight concern? And we're seeing that 1 in 5 young people have answered yes to that. And more females than males are answering yes to that, but not as much as we had anticipated, because usually there is an overrepresentation of females. We also asked, have you thought you were fat even when other people told you that you were thin? So this is a question taken from one of the most widespread questionnaires on eating. And this again, 45% are saying that they thought they were fat, even when other people told them that they were thin. And we're seeing again, slightly more females than males answering that, but not as many more as usual. So this is prominent across all genders, it seems. To be fair, from our perspective, I think we've been very surprised by the responses to the 4 or 5 questions on eating disorders that we have gathered. And so it's very important for us to think about it. And so what we thought we would share now is just some ideas about what to do regarding this. So what we know is that a whole school approach is really important when it comes to shape and weight concerns. That the whole school has to have kind of food and body shape friendly policies, which means that actually at lunch, if lunch is served or can be bought, a variety of food options from all food groups need to be available. And if in the curriculum we're being taught about healthy food options and distribution of different food groups, that actually what's offered in the canteen has to also reflect that. That meals should be an integral part of the school day with sufficient time allocated to it and expectation that all students attend and be together during that. That a no dieting culture is very important, to try not to comment about your own or other bodies or food choices. And that is important for staff as well as students, just to be aware that how prominent this is in culture, how actually in our social media questions we're asking how many young people, especially females, are looking at social media with regards to beauty and lifestyle in particular. That actually physical activity opportunities are needed in a non-competitive, non-weight focused and safe environment. Actually, interestingly, up to 70% of some of our year groups are saying they want to do more physical activity. So that's really important, that actually there are actually a lot of interest. So it's how do we make that accessible and available? And that public materials displayed in schools should include a diversity of body weight, shapes and appearances. We also need to think about the importance of early intervention. So for those that do have body image and weight difficulties, if we can get support to them early, how important that is, and that we need to make that accessible in schools, but also in particular to give a portal to friends who want to raise concerns about their friends that they're worried about, because it's usually the peer group will pick up on this first. And then finally, for those who have for example, required treatment for shape and weight concerns and eating disorder in particular, to enable them on a recovery path where they come back to school to link closely with family and a treatment plan. Okay, so I'm now going to hand over to Galit Geulayov. She's a postdoctoral researcher at the University of Oxford, and she has an interest in self-harm and suicide research. Thank you, Galit.
Thank you, Mina. Hi, everyone. So I'm going to talk a little bit about self-harm and about the findings within OxWell 2023. We've asked all students a series of questions about self-harm. We wanted to know if they have self-harmed ever in their life, how often, when they self-harmed last, and also if they were exposed to self-harm related content online. And what I'm going to talk about is actually the self-harm questions that were presented to secondary school students. So as you can see here, the first question we asked them is if they ever self-harmed. And I'm just going to reiterate what Mina said. These are early findings. We might have to adjust these findings even to adjust them after we do our further checks and review. But for now, you can see that about 67% reported that they've never self-harmed in their life. Another 12% didn't want to share this information with us. And then 19% reported that they've self-harmed at some point at the time leading up to the survey. And that is the pie chart on the left. Now, when we asked the adolescents about the frequency of self-harm or how often they self-harm, so you can see that of those students who reported that they have self-harm, so this is the pie chart on the right, you can see that about 40% have self-harmed a few times. Sorry, and about 14% said that they have self-harmed weekly, and another 13% self-harm daily. And when we ask students when they last self-harmed, and these results are not shown here, but 45% reported that they have self-harm within the past month. So it's very current. Next slide, please. So next, what we wanted to know is when they started self-harming. And what you can see here is the distribution of the age of onset of self-harm. And so, of course, you can see on the left that some students report that they have started self-harming even around the age of 5 and 6. But most of the students report that they have self-harmed, they started self-harming around the age of 10, between 10 and 13. And you can also see that many of those actually started self-harming around the age of 11 and 12. And this is something that we see in other studies, quite a common finding. Next slide, please. So what are the more practical implications of all that? So there is a need to start thinking about, and when I say start thinking, is thinking carefully how we assess and address self-harm in primary schools. We see that many, almost half of those who reported self-harm actually started before the age of 12. And so primary schools might be an important place to think about self-harm. And also another interesting finding that is it's related to OxWell data from previous waves, but what we found is actually that students who self-harm often approach their friends for support. So you can see how other students might be impacted. And so addressing self-harm within schools is potentially important, but the kind of challenge here is that at present there is little evidence actually to support any specific intervention. And the one thing that there is some evidence to support is that more whole school approaches rather than subgroup approaches, and when I say subgroup approaches, I'm talking about subgroups that are viewed as potentially at high risk. So whole school approaches are somewhat better, but still what we need to be doing is to continue and participate or involve schools in research about self-harm, and also about the best way to address self-harm within schools. So now I'm going to hand over to my colleague, to Rohan Borschmann, and he's going to talk to you about, he's a researcher and a clinician, and he's also a visiting academic from Australia, and he is going to talk about self-harm exposure to self-harm online. Rohan, to you.
Thanks very much, Galit, and thanks everyone for joining us today. As Galit mentioned, I'm going to be talking about self-harm as well, but a slightly different aspect of self-harm, specifically whether or not young people have come across self-harm related content on the internet, either intentionally or otherwise. So we asked all students from Year 7 onwards the very simple question: in the past month, have you come across any self-harm related content on any online platforms? And hopefully you can see the bar chart on the left there, the scale down the bottom. The big slice, the green one, that's 58%. That's for people that said no, they'd never come across any self-harm related content in the past month. But that of course means that 42% had come across self-harm in the past month alone. And so 23% reported that it was just a few times or once or twice, and that went right up to 3% reporting they'd come across this daily. So as a self-harm researcher and as a parent, I found this quite concerning. We thought that we'd look into it to see whether or not their responses differed, whether or not the respondents had themselves a history of self-harm. So the figure on the right there, it's the same question: have you come across any self-harm related content in any online platforms in the past month? The bar on the left is for people who reported that they do have a history of self-harm. And the bar in the middle is for those who don't have a history of self-harm. So there's the same color scheme. You can see that the bar on the left, about only 30% of people who had a history of self-harm reported that they have not come across self-harm in the past month. So that means that 70% of those with a history of self-harm have come across such content online. And it's basically reversed for those that don't have a history of self-harm. So only 30% of those had come across self-harm related content in the past month. So we wanted to look, thanks Mina, we wanted to look at whether or not they had come across this intentionally or how they come across such content, because it can be quite disturbing to see anything related to self-harm for young people. So we asked them, how did you come across this content? And you can see the two big slices down the bottom there. The one on the left, which is the blue one, 35% said that they accidentally came across self-harm content. And the teal color on the right, which is 45%, said that it came up on my feed or it was part of what I was watching. So if you add those two together, that means that 80% of people that came across self-harm related content online during high school, as in their high school years, weren't actively searching for that kind of material. So again, a very concerning finding, and certainly one we need to look into further. We've found that 40% of kids have come across self-harm related content, and most weren't looking for it. So in terms of what we can do and sort of meaningful steps forward, it's quite tricky with self-harm because it's such a multifaceted behavior. But there is research showing that a meaningful, genuine relationship with an adult for a young person outside the family is associated with lower levels of self-harm, lower rates of self-harm. So we would suggest that for anybody working in schools or any settings with young people, really, try and actively foster these genuinely meaningful connections. And kids themselves have told us that they're sort of calling out for these human connections. And Emma spoke about the loneliness. Lots of kids are feeling lonely. And this could be anyone in the school, from the people who are serving lunch right up to the head teacher. Because those two examples here, they're both young people seeking human connections that are not related to any kind of clinical services or health services. They're just adults that you come across in your day-to-day life. So yeah, we would really encourage anyone working in schools and settings with young people to try and address the loneliness and form relationships with these young people. We're also working, a few of us on this project are working on a Bracknell Forest children and young person self-harm workforce projects. And part of that project is involving, we're doing a review of online resources for people working with young people who self-harm in England and Wales and Northern Ireland and Scotland only. And so far we've turned up 351 separate resources that are for people working in this area with young people who self-harm. So it's an absolute minefield online, and we're currently in the process of trying to summarize what's out there and try and see what might be best helpful for young people and for people who work with them to hopefully reduce their self-harming. So I'm now going to pass over to Dr. Gaby Illingworth. Gaby is a postdoc researcher in the Department of Psychiatry here at Oxford, and her expertise is adolescent sleep research and how that relates to well-being. Over to you, Gaby.
Thanks, Rohan, and thanks everyone for joining us today. So there's a wealth of sleep data that's available from the OxWell survey, and we're interested in finding out about sleep because it's important for physical and mental health, mood and emotional regulation, relationships, memory, learning, decision-making, creativity, and academic performance. So next slide, please, thanks. So looking at the graph on the left, we asked, thinking about the past month, to what extent has poor sleep troubled you in general? And this shows the percentages who answered by year group. So years 5 to 7, here we can see that reports of sleep problems are fairly similar. So 1 in 10 said poor sleep troubles them a lot. Then we see a steady increase across the year groups in reported sleep problems. And this fits with what we know about how adolescence can be a particularly challenging time for sleep. So there are changes to the biological regulation of sleep during adolescence, so they prefer to sleep later and wake later, and this can be compounded by psychological, social and environmental factors. So when we get to year 11 and 12, 1 in 5 people said poor sleep troubles them a lot, while in year 13, this increases to 1 in 4 reporting that poor sleep troubles them a lot. And we also asked about the frequency of sleep problems. So how many nights a week they have a problem with sleep. So in secondary school and FE, year 7 to 13, 40%. So in other words, 1 in 7 young people said they have problems with sleep 5 or more nights a week. So this suggests there are considerable numbers of young people who regularly struggle with their sleep. Next slide, please, thanks. So we also looked at daytime sleepiness, and we asked, during your daytime activities, how much of a problem do you have with sleepiness, defined as feeling sleepy or struggling to stay awake? And here, in line with reports of poor sleep, we see an increase in sleepiness across the school years. So in year 5 to 6, about 40% say it isn't a problem, while 6 to 7% report a big problem with sleepiness. And then looking at year 11 to 13, only about 16% say sleepiness isn't a problem, while 22%, so about 1 in 5 young people, report a big problem with sleepiness. And this year, for the first time in Oxford, we've asked about napping for those in secondary school and FE. And we're interested in napping because it may indicate young people are experiencing insufficient sleep. So during the day, 12%, so about 1 in 8 young people, quite often to always nap for more than 1 hour. And then after 6 p.m, 7% sometimes nap, while 7% quite often to always nap. And the timing of this is important because napping in the evening may mean that young people feel reduced sleep pressure at bedtime and so may struggle to go to sleep. So next slide, please. So what can we do? So there's a move worldwide to develop and introduce sleep education in schools to increase knowledge about sleep and how it's important, and to potentially change sleep behaviours and improve sleep. So information tends to be provided on sleep hygiene, or the habits and practices that may impact sleep, and how it's beneficial to have a regular sleep schedule, so going to bed and waking up at regular times, and ways to feel calm and relaxed at bedtime to help sleep. So Brainwaves is a new research platform focusing on adolescent mental health and well-being, developed in conjunction with the University of Oxford. And as part of this, lessons have been developed for use across secondary schools and sixth forms. So a key stage 5 lesson on sleep is available to download with accompanying notes and teacher guidance. And key stage 3 and 4 lessons will be available in the future. So if you're interested in taking part in this free initiative, that would be great. And the lessons are available via the web address shown on the screen. Also, sleep lessons for key stage 1 to 4 are available via the PSHE Association. And I'm now going to hand over to Dr. Holly Bear, a postdoctoral researcher at the University of Oxford, who's going to talk to you about online behaviours.
Thanks, Gaby. Next slide, please, Mina. Thank you. So we know that adolescents spend a lot of time online and on social media platforms, and that social media is actually a huge part of adolescents' daily lives and how they socialise and interact with peers in the wider world. And I know at the moment there's a lot of discussion in the media about social media and the impact that might have on adolescents' mental health. And there can be mixed messages there, so it's quite difficult to unpick some of that. But we actually know from previous years of the OxWell survey, so in 2021, actually it's what adolescents do online rather than how much time they spend online or what time of the day they're on social media that seem to be important for mental health and loneliness. I know there's been a question in the chat about the association between social media and loneliness. And actually, when we looked at the data for 2021, we actually only found a very small association between those two things, but it's something that we're looking at further in the 2023 data. But what we do know is things like being exposed to self-harm related content online, like Rohan mentioned, and posting things online that you later think, oh, I wish I hadn't posted that. So kind of regretting posting online are all important and seem to be associated with mental health outcomes and loneliness. So this year we asked a whole host of extra questions to find out more about the types of things adolescents are doing online and what the impact of those things might be. So you can see here, we asked adolescents, in the last 12 months, have you met up in person with anyone you had met only online, so that they had no mutual friends with? And about 1 in 10 told us that they had done that. So it's actually quite striking, I think. And then a further 7% said they didn't know or didn't want to answer. So I think that's quite an important finding, actually. And we know from our 2021 analyses that this variable, so meeting someone online, is associated with mental health symptoms like anxiety, depression, and loneliness. So it's something that we're certainly looking at again this year, and we'll explore again. So this year, we also asked adolescents about their parents and carers and the role that they have in providing more adaptive, active guidance versus more kind of regulatory approaches to their internet use. And you can see here, so it's kind of split. On the left, we've got more kind of adaptive, active guidance, so encourage you to explore and learn things on the internet, talk to you about what you do online, explain why some websites are inappropriate, and help when something bothers you on the internet. And then on the right-hand side, that's more things about kind of restricting access and checking and kind of monitoring internet use. So we're in the process of analysing this data at the moment and looking at the associations with different outcomes like loneliness and mental health. But emerging findings do seem to suggest that more active guidance has a protective role and may be useful in supporting adolescents to use the internet more safely. Next slide, please. No? Okay, so in terms of what to do, I think given our findings, it's important that we move away from the slightly more kind of reductionist approaches that see social media as merely helpful or harmful, and instead consider the nuances of kind of for whom and in what ways social media affects mental health outcomes. So we know that inappropriate and harmful content continues to be easily and widely accessible by adolescents. So Rohan kind of touched on that in his slides. So I do think based on that, technology companies can play an important role in kind of designing safe online environments to minimize the risks associated with social media. But I think beyond that, so beyond kind of policy and technology companies, I think that clinical and educational and family settings are all important points of contact where young people could be encouraged to reflect on their social media use. And it may be that incorporating strategies into lessons to reduce things like cyberbullying or preventing adolescents from engaging in more risky online behaviours could be quite useful strategies. So I think all in all, a kind of multi-pronged approach to tackle this is needed. And on that note, I think I'm now passing to my colleague Neith. Oh, no. Mina, am I doing these slides too?
I just want to say, sorry, before we move on to Punitha, which Holly, if you could introduce her in a moment, we are very aware of the groups that are not participating in OxWell. And so we do have a non-mainstream survey that has just gone live. So it'll be open until December. There's information on our website. We would be very keen for non-mainstream schools anywhere in the country to participate. And so please just consider that if that's possible for you. The other thing that we are developing is a positive practice inventory. So we'll be contacting our OxWell schools, learning from the responses and building a resource for everybody on what's been happening in the same way that Chris was talking about, kind of learning from the schools where children are perceiving bullying being dealt with well and sharing that practice. I think given that there's still so much to learn, the evidence base is not sufficiently there. Not only do we need to engage in as much research as we can, but also we can learn from what is currently taking place. Okay, back to you, Holly.
Okay, thank you. And now I'm passing over to our lovely colleague Punitha, who's visiting undergraduate student and who's going to tell us about some of the key dissemination activities of OxWell. So it's very exciting. Over to you, Punitha.
Thank you, Holly. Next slide, please, Mina. So our team takes youth dissemination of the results very seriously. And as a young student myself, I've been able to provide youth perspective into how we can best share the OxWell survey results back to students. Youth dissemination has been something the team has done every year. For this year, the results of the OxWell 2023 survey has only been out for about a month now, but in this little time, we've created posters and postcards, as shown on the slide, of the top 10 findings from the 2023 survey. And so on the left-hand side are examples of what the posters look like, and the right-hand side are postcards. And these resources were created from input from students and are designed to help make the data more accessible to students, teachers, and schools. These resources are currently available and they exist on the resources page of our OxWell webpage and are accessible for anyone and everyone to download. And for schools that have taken part in the survey, we're also happy to send over copies if you are able to send us an email to our OxWell email. And in addition to creating the previously mentioned resources, we've also had the opportunity to actually engage with young people at events and local conferences. So most recently, this past Tuesday, I attended the Liverpool Youth Dissemination event at the town hall, as Chris talked about previously, which was an amazing opportunity to have students engage with the data and have their voices heard about what type of support they'd like to see. The OxWell team has also presented at 2 Youth in Mind conferences, one in Berkshire last Tuesday and one in Oxfordshire this past Tuesday, which was again an opportunity to share findings with both the students and adults in attendance, and to also have student perspectives be highlighted and be heard. And if you have any other ideas about how we can best reach students, we'd love for you to please share them with us in the chat or just send us an email.
Thank you very much, Punitha. And we're so lucky in OxWell to have just amazing input from so many people that we're very grateful for. Punitha's also pushed us to make a video of our findings for school children, and so that should be ready next week and will be available. The OxWell schools will be emailed about it, but any other schools that might want to show it to their students are welcome to. The link will be on our OxWell website for anyone to look at. We also have what's been referred to a few times at this talk as Load Seeker. It's the name given to a data portal that's been created, and in that data portal, students can look at the data, local authority partners can look at the data, and also national organisations. So many of our third sector partners are keen, if they're involved in physical activity work. We've got important data on exercise and things like that. So we're trying to create the system and structures in order to make sure that as many individuals as possible can give us this data, because we're so kind of aware of the privilege we have that so many people have participated. Young people have trusted us with their voice, and they actually really want it to be used for the benefit of as many kids as possible. So that's what we hope to be able to do, and we welcome ideas from as many of you as possible, either to tell us what you think we should do or to join us in doing that, and keen to share these findings. So I'll now pass over to Janette to introduce herself and tell us a little bit more about that aspect of work as well.
Hi, thank you. So I just today was about the national insights, and interestingly, I think about 50% of the people that signed up were from areas that took part in the survey, but 50% were from people in areas that didn't take part in the survey, and a whole range of organisations, from schools, some international. I know someone's just posted a question about other countries. So I just wanted to just kind of recap. So the schools have had the data at a school level, all the individual schools that took part. At a regional level, we're working with the commissioners. I put in the chat earlier about who the commissioners are in each area. So in Liverpool, the commissioners are the local authority. In Milton Keynes and Oxfordshire, it's public health. And then in Berkshire, it's the NHS. So they've got the data at the area level. So if you're from those areas, we can put you in touch with the people who are holding the data at an area level. But I think
I'm just going to interrupt. So Janette, could you just tell us your background, because it's so relevant to these discussions?
Sorry, I mean, I didn't introduce myself. I'm Janette. I'm helping with the OxWell team, and my background is NHS commissioning, and then previously a youth worker in practice. That's what my background is. But I've been helping get the schools engaged, helping the commissioners, and also sort of now working with the commissioners to say how are we going to use the data to help sort of drive change at that level through the commissioning of services. So sorry about that. I just jumped in with what we're doing. I think the other thing is that certainly I'm getting asked a lot is about what about the national data, the aggregated data, some of the insights that we've shared. And I think Mina said we are looking at people being able to have access to this. So wherever you're from, whether you're from a charity or another area, being able to see those national insights, which are held on the data portal Load Seeker. So just watch this space, because we are looking at how we can make that happen, because I think certainly a lot of people are interested in it, funding bids or just policy changes or whatever you want it for. So yeah, so next slide, please. Are you doing the next slide?
Yeah, so that's it, everyone. So we just do want to thank so many people, primarily the students who generously gave us their data, the school staff for whom it was no easy task to manage such a complex thing of taking whole classes, getting them into their IT suites to complete the survey and support the students in doing that. We have received funding from the NIHR Oxford and Thames Valley, for which we're incredibly grateful, and we have incredible support from our local authority and city council partners. If other areas want to get involved, we would love to hear from you. If you're a school in an area not involved, get in touch with us. Together we can go to your local authority partners. We want to make sure the findings are used, which is why we think that it's so key to work with our commissioners and local authority partners. And then I personally want to thank an incredible team of researchers and interested individuals and committed, passionate professionals like Janette and Chris, who work alongside us to try and help us make the most of this finding. So the research is coming out. We will keep you informed of that as well. So thank you very much. There are many ways to keep in touch. So through a newsletter, there are 2 codes there. And then we have through Twitter, Insta and LinkedIn as well. So with that, thank you very much everyone for joining us, and I'll end the formal part of the presentation now.